Hi guys, today I'm sharing another case with you. This is a case of painful arc syndrome in a boy of 20 years. This boy presented with severe pain in both the shoulder joints, and as is commonly seen in painful arc syndrome, the pain used to get worse from heavy lifting and exercising. The boy also felt extreme weakness in both the arms. Apart from this, he also presented with pain in both shin bones and both the SI joints. The patient exclaimed that all his pains used to get worse at night. The pains caused immense anguish, and the boy was greatly troubled by his situation. Taking into account the physical generals, the boy had a chilly thermal reaction, had increased thirst, desire for very spicy food, used to sweat on the scalp and forehead, passed stools 2 to 3 times a day, used to sleep on his abdomen, and there was drooling of saliva in sleep. Boy also complained of profuse hair loss and eruptions on the scalp. He suffered from offensive breath and also recurrent aphthy. As a person, he used to get angry very easily, and every trifle caused immense anguish to this boy. Now, what we have to learn from this video is when any medicine comes in our mind based on the PQRS symptoms, we must refer to the Materia Medica to be sure whether those symptoms have been produced in the provings of that medicine or not. I did the same thing. I will narrate the symptoms from chronic diseases, and later I shall reveal the name of the medicine. The symptoms are very discontented and peevish over his pains and discouraged, vexed about trifles, very peevish, every trifle vexed her, least thing put him into a violent passion, he could have murdered anyone without hesitation. The hair falls out very much. Salivation, collection of saliva on the right side of the mouth. Bad smell in the mouth as from a spoiled stomach. This he perceives himself. More thirst than hunger, uncommonly great thirst from morning till evening. Appetite only for sour and strong tasting piquant things. Now the symptoms pertaining to the SI joint, it says pain in the sacrum frequently recurring. In the sacrum, a pain drawing hither and thither, worst when walking. Pain in the sacrum as from fatigue, when stooping and when leaning back while sitting. Severe pain in the sacrum like a cutting through during movement and at rest, so that she could neither stand, walk, nor lie down. Bruised pain in the sacrum when walking. This patient also had an aggravation from motion in all his joint pains. bruised pain and sharp pressive pain in the sacrum and the lumbar vertebra, but especially in the junction of the sacrum with the pelvic bones. It darts down into the lower limbs and causes a sort of limping in walking. The pain continues while sitting, standing, and lying down. Now, symptoms pertaining to painful arc syndrome. Pain like a load on the top of the shoulder. The top of the shoulder is painful when raising the arm. Drawing pain in the top of the shoulders, fine tearing in the top of the left shoulder, pain as of a sprain in the top of the shoulder. In the left arm, here and there, some jerking, bruised pain in both the arms, and great fatigue in both the arms. Drawing pain in the shoulder joints, the hips, and especially the knees. The pains are worse at night. So, we get the complete symptomatology of the patient in this proving. Friends, the medicine prescribed in this case was HEPAR SULPH in ascending LM potencies. The symptoms that led me to HEPAR SULPH were a chilly and thirsty patient, the excessive violent anger, recurrent apathy, offensive breath, drooling of saliva. Now these symptoms point to the syphilitic taint in the patient. Another very important point is that when we consider hair loss with a syphilitic background in the patient, all his pains were worse at night, he had pain in the shin bones, all these symptoms pointed to the inherited syphilitic dyscrasia in the body. So whenever we have hair fall with a syphilitic background, three medicines should come to our mind: HEPAR SULPH, Kali iode, and syphilina. Especially HEPAR SULPH and Kali iode were the most used medicines by Richard Hughes. The basic motive of putting this video is that we should always refer to the Materia Medica whenever we are having some medicine in our mind, to be sure that that medicine is capable of covering the entire symptomatology, including the PQRS symptoms of our patient. Thank you for listening. Have a great day.